Ms. Crow.
Hi.
Hi, my name is Patty. I'm one of the transplant pharmacists with the team.
Hi, Patty. Nice to meet you.
How are you doing today?
I'm doing good, thank you.
Good. So I'm here to talk to you about the medications that you're going to take after transplant. But before we get into that, I'd like to explain why you're going to need to take these medications.
Okay.
So your body's actually quite smart, and so your body's going to know that that organ isn't yours. It's going to try to fight it off, just like it would fight off an infection or a cold. So we are going to have to give you medications in order to prevent the cells in your body from attacking the new organ. Does that make sense to you?
Yeah, I think it does.
Okay, great. So the medications you're going to take after transplant could vary. There will likely be at least 2 new medications after transplant, but the doctor and the team will decide what those are at the time of transplant. These medications, like I mentioned, are going to decrease your immune system. And so in doing that, we're preventing what we call rejection. So we're preventing your body from rejecting the organ. Okay. These medications do have side effects, but we're going to be monitoring you very closely. We're going to be checking levels of the drugs in some cases, and then obviously talking to you about any issues that you're having. And we might be able to adjust the dose or give you a different medication depending on how the drugs are working for you.
Okay. Do I take these meds for life?
Yes, you do. You do, definitely. The risk for rejection is always there. Like I said, your body is smart, and it's going to it will figure out that that organ isn't yours pretty quickly if you stop taking the meds.
Okay.
Okay. The medications as well, they can be once a day, twice a day. We try to have them be in that range, but there will be a variety of different medications. Okay. As well, since we're decreasing your immune system, we are actually putting you at increased risk for infection.
Sure.
Does that make sense?
Yeah.
Yeah.
I never thought about it, but it does.
So we're going to ask that you try to be very careful around sick contacts, good hand washing techniques, those types of things to prevent infection, but we're also going to give you some medications to help prevent infection. Those could be to prevent bacterial infections, viral infections, fungal infections. So again, same as the other medications, we'll decide which ones those are going to be at the time of transplant, but it's likely that one of those, if not more, could end up being lifelong as well.
Okay, so I have my new anti-rejection drugs, and I have these infection drugs, but what happens to my medications that I'm on now?
Well, the total number of medications that you're on is going to stay the same or increase. The meds you're on now, we may end up having to change those for some other meds. Some might stay the same. So we'll just have to see how you're doing after the transplant and go from there. But in general, we're adding on new meds. Okay. And then lastly, I'd like to just kind of go through some tips for success. We're obviously here for you. So we want your kidney to work just as much as you do. So we would ask you to call the clinic if you have any questions about your medications. If you're having any problems with your medications or side effects, please give us a call so we can discuss that with you and what the best plan would be. As well, adherence is really important after the transplant. So like I said, your body's smart. So we have a few things that we like our patients to use after transplant. So this is a medication pill box that a lot of patients like to use. The reason being is you can remove one day. And so if you're coming into clinic, you could bring that whole day's meds with you. Okay. In addition, we'll be giving you a medication chart like this one.
Oh, that's nice.
That'll list out all the medications, and it'll have little check marks as to when you're taking what time of the day you're supposed to take each medication.
All right.
Okay.
You know, I have a friend who's going to be helping me with my transplant. Is there any way that they could hear this information or come to clinic with me?
Of course, yes, we would definitely recommend that actually. Having a friend help you, come and listen to the information, it's another set of ears and somebody else who can ask questions and then be aware of all the new information that you're going to receive. So that person is more than welcome to come to clinic, and obviously they can come visit you in the hospital after transplant as well, so they can start learning that information. Any other questions that you have?
No, I don't think so. This was all very helpful and made sense.
Okay, Wonderful. Well, great meeting you, Ms. Crow.
Nice to meet you as well. Thank you.